Definition: Bell's palsy is a form of temporary facial paralysis resulting from damage or trauma to the facial nerve, cranial nerve 7, which controls the muscles on one side of the face. It typically causes sudden weakness or paralysis on one side of the face. Causes and risk factors. Exact cause. The exact cause is unknown, but it's often linked to viral infections, which may cause inflammation and swelling of the facial nerve. Common triggers: associated conditions: herpes simplex virus, HSV1, Epstein-Barr virus, varicella-zoster virus, shingles, cytomegalovirus, Lyme disease, diabetes, pregnancy, especially third trimester, upper respiratory infections. Pathophysiology. The facial nerve passes through a narrow bony canal in the skull. Inflammation causes compression in this tight space, disrupting nerve signaling and causing weakness or paralysis of facial muscles. Symptoms. Symptoms often appear suddenly and may include sudden weakness or paralysis on one side of the face, drooping mouth or eyelid, inability to close one eye, drooling, loss of taste on the front 2/3 of the tongue, increased sensitivity to sound, hyperacusis, on the affected side, difficulty with facial expressions, headache or pain behind the ear. Diagnosis: primarily clinical, history and physical exam, rule out stroke, tumors, or other neurological conditions. Tests, if diagnosis is uncertain, MRI or CT scan to exclude other causes, electromyography, EMG to assess nerve damage, blood tests for infections like Lyme disease. Treatment: 1. Medications. Corticosteroids, e.g. prednisone, most effective if started within 72 hours of symptom onset. Antivirals, e.g. acyclovir or valacyclovir, sometimes used if a viral cause is suspected, though benefit is uncertain. 2. Eye protection. Use lubricating eye drops and eye patch to prevent corneal damage due to inability to blink. 3. Physical therapy. Facial exercises to maintain muscle tone and improve recovery. 4. Surgery. Rarely used. Nerve decompression surgery is controversial and not routinely recommended. Prognosis. Most people begin to recover within 2 weeks. Full recovery in about 70 to 90% of cases within 3 to 6 months. Some may have residual weakness, involuntary facial movements, synkinesis, or muscle contractures. Differential diagnosis: stroke, Ramsay-Hunt syndrome, brain tumor, multiple sclerosis, Guillain-Barré syndrome.